G'day, Eric Bakker here, naturopath from New Zealand and author of Candida Crusher. Thank you for checking out this YouTube channel and thank you for tuning into this video today. Here's a question I got asked from a lady in Australia. How long is Candida die-off? How long does it take for me to finally overcome these dreadful feelings that I've got of die-off? I've done a few videos on Candida die-off, and let's get one thing straight. Are you sure that it's Candida die-off? Are you sure it's not something else? Many people I see and have had consultations with swear that they're getting Candida die-off, but in fact they're not getting that at all. They're getting a totally different reaction. They're getting a detox reaction, or they're getting a reaction to a change in diet, or they're getting a change in way they feel because they've withdrawn certain foods from the diet. So there are different reasons why you could be getting the feelings that you're getting, and you may misconstrue these feelings and believe that it's actually what we call a Herxheimer reaction or a die-off. True die-off occurs when lots of Candida die and release their contents into the digestive system, okay? Not in the bloodstream. You're not going to kill millions of Candida in the bloodstream and you're going to create a toxic reaction. It's usually always in the gut. So when that occurs, you can feel pretty sick and toxic. Normally it's going to last anywhere between 2 days up to about 10 days. Generally I would find 5 to 7 days. And usually the first 24 to 72 hours are the most intense and toxic experience, and then it will taper off and then you'll feel fine again. How can you avoid die-off? You can avoid die-off with common sense, like anything in life. But remember, I've told you guys this before, common sense isn't very common with a lot of people out there who are treating for Candida. So if you've got severe Candida, if you've got major brain fog, if you feel spaced out and you've got joint pain, and you're very sick, you're tired, you've got a lot of gut problems, then you need to be very careful when you start on a course of treatment, particularly a strong antifungal treatment. If you go too quickly into something and take like a mega dose, there is a possibility you're going to set yourself up for a fall. You're going to feel pretty crappy. So what you want to do is go into it nice and slowly, nice and gently. I look at the sensitivity of the patient. And I mentioned before there are 3 types of patients I see. There's the normal people, like me and you, most probably. They account probably for about 75%, 80% of people. And these people don't usually have violent reactions to things that they take. Okay, they can take B vitamins, they can take fish oils, they can take multivitamin, vitamin C, they can take all sorts of things. They're not allergic to pharmaceuticals. They don't generally react to things quickly. They can generally find that they won't usually experience die-off, and if they do, it's very mild. The people who experience die-off the most are the ones who are sensitive, and particularly what I call the supersensitives. The supersensitives are people who react to everything in life, okay? They can take one vitamin C tablet and feel sick for 2 days. They can take a B vitamin and they can have like a bad headache or not sleep for 2 or 3 days. They've got known allergies and reactions to multiple foods, chemicals, drugs, all sorts of things. If you know that you're very, very sensitive, then you need to be very, very careful if you've got Candida, because you're the person most likely to experience the strongest reaction when you go on the correct course of treatment. The regular patient will not experience this unless they do something dumb, like take 50 antifungal tablets in 1 day, which some people do, by the way. I've had some patients take 30 to 60, even 90 tablets per day, thinking that they're going to get rid of it fast. So there's no real benefit to that, and all you're going to do is make yourself feel sick. So how do you know you're not experiencing an aggravation in terms of your diet? How do you know you're not experiencing a withdrawal from caffeine or another food? Excuse me. So many people who start on an anti-Candida approach, okay, make multiple changes at the onset. Too quick, too soon, too many. That is a silly thing to do, because then you're not really sure, where these feelings are coming from. All right? Let's just say you were drinking 3 or 4 cups of coffee a day, or 5 or 6, and you stopped all of a sudden. You started to change your food quite rapidly in the same week, and you took an antifungal and perhaps a probiotic all in the same week. And then you get sick, and then you turn around to me and say it's a die-off. Well, hang on a minute. What about the caffeine reaction? Maybe that could account for the skull-piercing headache you had for 3 days. What about the fact that you stopped bread or gluten all of a sudden? That could make the gut change, okay? Bowel flora can change quite rapidly too with the diet change. and that can make you feel quite spaced out, sick and bloating. All right, so if you really want to know whether you got die-off or not, is make the diet change very, very slowly, and then very slowly introduce an antifungal. If you really want to know whether it's die-off or not, don't make any changes to the diet, just take the antifungal itself. All right, and then maybe take 3 or even 4, even 6 doses per day. If you experience bad feelings with the antifungal medication, this could well be related to die-off. All right, but don't get confused. Too many people I see get confused and don't really understand what die-off is. If it's true die-off, it's going to last, as I mentioned, between 2 days up to about 7 to 10 days max, but normally around 5 days, 5 or 6 days. So I hope that answers your question. Thank you.